I know I'm a rookie, and that's my first scan, and I've got some blue clearly to fill in the blanks, but that didn't take very long to get us to that.
Hey guys, listen, day in the life at East Amherst Dental Center, really cool. You've probably seen this scanner before. It's called iTero. It's from a company called Align, and my buddy Joe came to hang out with us today to show me how this guy can integrate into our practice here in East Amherst, New York. All right guys, so here's the scoop. Here's what I know about iTero. I've been teaching scanning for, 20 years. I've test driven every scanner on the market. What I know about iTero's history is this. You and I, we know this guy mainly for Invisalign, right? It's been an orthodontic scanner, and that's the lineage of iTero. But what I've learned about iTero over the last maybe 8 months or so is that it's a tremendous restorative scanner, right? So we can use this in our practice in two main different ways. So pre-case acceptance, it's a tremendous teaching tool. I love it, right? Because we can put this in the hands of our hygiene team, our assisting team, and my hands too. And we can track historically where a patient's been with things like occlusion. We can look at tissue, we can look at recession, we can look at wear patterns. And that's all about helping you and I get our patients to understand what we know is really important to them and educate. And then on the post-case acceptance side, again, like you guys know this for scanning for Invisalign, and that's an awesome tool. But it's an equally awesome tool when we start talking about traditional restorative dentistry. So dentists all over the world are using this to scan for simple crown and bridge. They're using it for dental implants. They're using it for occlusal guards. I'm guessing we can probably hook this up and we can 3D print and we can mill and do all sorts of things in dentistry that we're doing in lots of different spaces. So it's a really cool tool. And I'm going to be a jerk right now because the last scanner I bought 20 years ago, I made somebody jump in the chair with you game?
Yeah, definitely.
Yeah, so let's see how it works.
Just do new scan. Let's scan. All right, guys, from my limited knowledge, I'm going to work from posterior to anterior. I'm going to get my lingual. I'm going to do a little rocking and rolling. And then I'm going to come to the other side. It's pretty fast, super fast actually. I'm going to rock and roll. Now I'm just kind of playing, so I apologize in advance, but you know, it's super fun. I will tell you immediately my first favorite feature is the fact that there's a button on either side of this scanner. So I can turn it on and off with my thumb or my forefinger. That's kind of cool. And I know I'm clearly doing this sort of against the process, but I'm doing this on purpose because I want to see what it does. And I'm doing this sans retraction, sans obturgates, sans everything, but I know I'm a rookie, and that's my first scan, and I've got some blue clearly to fill in the blanks, but that didn't take very long to get us to that.
All right, thank you for having me. I'm really excited, David, to get in here and really go through the iTero scanner, really show different generations of doctors out there exactly what the scanner entails. And some people may or may not know iTero as a brand name. So again, Dr. Racy mentioned we have Align Technology as the parent company. We have Invisalign and iTero. Those are our two products, kind of our two pillars of our company. iTero is its own sub-brand, and it actually started a while back as the Cadent brand. So that was actually, we say the first, but not really the first, one of the first, we'll say, restorative scanners in the market. And why we sometimes say the first, because it was the first open source, meaning an open STL file. You were able to take that file and do with it whatever you wanted. So Cadent started back in the mid-90s, a little bit later as we got into the 2000s and into the 2011, 2012. iTero, Cadent was purchased by Align Technology and brought on board, and really why you saw kind of a transition maybe a little bit more towards the orthodontic side is because, again, Align being an orthodontic company, it was a great platform and a vehicle to actually deliver patients that excellent experience going through aligner therapy in a digital format. So it was really that platform. And the roots are, again, in restorative, and we're really trying to focus on that because it's a very powerful tool and a very powerful machine. So what we're gonna do is we're just gonna deep dive a little bit into the scanner, some of its capabilities. What we're gonna focus a little bit on are the pre-case acceptance, meaning before the patient accepts the treatment plan, we wanna go over how we can use those tools to actually show the patient. And then a little bit after, we're gonna go through, on the typodont, a little bit of our our restorative workflow. So we're gonna go through maybe a crown and also an implant. Perfect. All right. So just to get started, we're going to talk about pre-case acceptance. Dr. Rice did a great job kind of explaining that earlier. I just wanted to show just a few quick demos here. So what we're going to look at are both soft and also our hard tissue in the mouth, and we're going to compare that over time. So I'm going to use what's called time-lapse technology. We're taking 2 scans for this patient that have happened, and we're going to compare them over time. Now, for demo purposes, they obviously are on the same day, but what I want to do is just build that conception of what's happening and what we can take that patient through. So again, what we always want to make sure we use as we're talking to the patient are, it's really key, and this is what we really coach a lot of our doctors, are using terms that end in ing, right? It's not, it's your gum didn't recede, it's receding. It's the act of something happening. So here we have our teeth are wearing. So now we can show the patient here on this 3D model. Again, it is in color. It is also in stone. We like to use stone because you can see more surface texture. What we're going to show is where we have color, red being more severe, yellow being a little bit more mild. We're able to take this magnifying glass, move it over the posterior teeth, and we could show the patient how their cusp tips are wearing. And we could actually show them the wear over time. So we can take this down all the way to 0.05 millimeters of wear, which is undeterminable by the human eye, but on the scanner we can actually show that and show the patient over time what's going on. And now we can really build our case or just build our knowledge to the patient of exactly why our treatment plan is necessary or why maybe monitoring something that's a concern is important, because now we could monitor it and have actual data to back it up so we can show what's going on from visit to visit. Whether it's at the 6-month point or the year point, we could show the patient what's going on over time. All right, so that's really with tooth wear here. I do want to show you just another one that we have. This is great. Me personally, I have some gingival recession that I have going on, and what's great is this is my scanner, so I get to scan myself quite regularly, and I get to actually keep track of it. I have gone to the doctor, and recently I had my probing done, and I asked, what kind of wear happened, or what kind of change happened in my teeth over time. She looked down at the chart, and she said, yeah, I think it's about the same. It was about 4 years, and they don't have an iTero scanner yet, but we'll work on that. But again, I just wanted to kind of see what was that patient experience like for me, maybe being a little bit more educated than a normal patient, but wanted to see how would they respond? How would they be able to show me, and what would they do? I didn't see any diagrams. I didn't see any numbers. She just looked down and said, it seems about the same, which was good. It's good to see that it's about the same, but I can see, a little bit more clearly with, information. Seeing is always believing. Here I'm going to turn this on to color, and now we're going to look at this gingival recession here. So again, this is a typodont, but again, the theory and the concept is we're now showing the patient what's happening to their gingival surface and how it's receding. Again, using those ing words to really indicate that it's not something that happened, it is happening. And now we can get into the root cause of what's going on and really talking to them about how we can potentially save them significant time and money and pain by getting into a treatment earlier than later. That's what we're all about, doing it minimally invasive and trying to save the patient as early as possible and noticing it. All right? Perfect. So that's the time-lapse technology. The next one I want to show you here is going to be one of our most powerful tools. And I'm going to bring up a live patient for this one, all right? I'm going to pull this one up, and I'm going to go to the viewer tool. So the viewer tool is where we just view a scan. Now, what we really like to teach are scanning in the hygiene room. And the reason being, you see patients on a daily basis. The easiest way to provide better care to your current patients is having the best look you can at each of them. So if you can scan, really get that used to the hygiene room, you're looking at 3-5 minutes, maybe 7 minutes, of scanning, but really on the lower side and really capturing the record so we can, again, show patients what's going on. But in your hygiene room is where you see these patients on a regular basis. So this patient has severe crowding, and what we're going to do is we're going to turn on what's called the occlusogram. So this is going to show where this patient has contact points. So people always think red is bad. Well, yeah, red is bad, but without red in the posterior, they wouldn't be able to chew, right? So it's all about where are those contact points and exactly getting them in the proper spot so we don't have excessive wear that are creating areas of concern. So now what we're really getting into, each patient, we like to pull it up in this view here. Let's see, kind of side by side. I have the upper off, that's why that was doing that. There we go. So we like to actually educate the patient all around the mouth, and we call this, really going over, malocclusion, just what exactly is going on, an analysis of their occlusion, really explaining to them what's going on and why we see areas of concern. We could then, again, just like other scanners, turn it on in color. You could get into those actual wear spots. We can then turn off the color and we could talk about why they're chipping their teeth and exactly what's going on and really build that treatment plan that's needed for the patient. And again, seeing is believing. So this patient is in his mid-40s and has had these teeth obviously forever and really never got anything done about it. And for this patient, really what it comes down to is Invisalign, And that's why our brand being iTero and Invisalign is so important, because it becomes almost a holistic approach. You can now go in and align these teeth as we start getting through their treatment. Maybe you start doing some restorative work, but again, it's all about having the proper landmarks and the base for the teeth to occlude properly. And that's really why iTero is the perfect platform for Invisalign and also leads into that restorative workflow. All right, so let's touch base a little bit on our restorative workflow. Sound good?
Yeah.
Great. All right, so now we're just gonna do a single crown on tooth 19 here. I'll just go through the simple workflow and just kind of the ease of use of the iTero scanner. So we're just gonna go in, we're gonna set up a new patient. All right, we're gonna go ahead and pick their first name. I'm just gonna make this one up. All right, so I'm just gonna type in a bunch of letters here. We're then gonna drop down, if it was a patient that existed, it would automatically link to their account. We're gonna go to restorative. We're gonna select the due date, so whatever our laboratory due date is, and then we're gonna choose our laboratory. So we have a drop-down box with the labs that you use. When a doctor buys a scanner, we ask them what labs. So when you get it, you only have the list of the laboratories that you want. So you don't have every laboratory that's in our database that can confuse you. It's designed to be easy and simple. What's nice is as you're filling this out, it's also available. It's all links to our portal, so you can actually have an office assistant set up all your RXs beforehand in the morning, so that way as you come in for the day, it's already filled out. And maybe the only thing that's not in there is the material type, because as you're cutting down the tooth, you decide, hey, I need to do a different material than you originally had marked. So we try to make it easy and give you the options to do whatever you want. All right, so we're gonna do a single crown on tooth number 19. We simply touch 19. We're gonna select crown. You do have all different options on there. All right, we're gonna select our material, posterior. For the most part, we see a lot of doctors just going with full contour zirconia. We're gonna select our prep design, so we'll say that this is a shoulder, and then our shade. We have several different shade systems, but I'm gonna go ahead and say this is a A3. All right, I'm gonna go ahead and select back. You have your text here, or your box here, that shows your text for your tooth that you're ordering, 19. If you had more teeth that you were prepping, you would have subsequent cards next to it. And then we have a note section. If you did want to say any notes in here, you can go ahead and type them in to the laboratory. All right, we're then gonna hit the scan button. All right, the scanner's gonna fire up. You're gonna hear some fans turn on. That's basically the anti-fogger starting. Earlier, when I was scanned, you could see it fogged up because we didn't really give it a second or two to turn on, but you can see when the fogger's turned on, boom, instantly it went away. So it's something we're really proud about. All right, the light turns on, that means you're ready to go. We do workflow a little bit different with the iTero. You can see right now we just have the prep highlighted. We also have the arch, okay? So we start with the prep, and the reason we do this is we wanna put the scanner right over the tooth that we're prepping. And we wanna capture this in 5 or 10 seconds. So I turn it on, and I'm just gonna rotate a little bit to the lingual to the buccal. I'm just gonna get all of my contact points and make sure I get that margin line, okay? Just gonna put this back and look. So that was about 5 or 10 seconds. The reason we do that is as we're packing cord or whatever retraction method we're doing, we wanna make sure that the tissue is retracted but also dry, okay? So what this allows us to do is capture that real quick and move on. So what we're gonna do is as we keep scanning, we're gonna take this section, we're gonna save it for later, and after we're done scanning, we're gonna remove that section, we're gonna throw this beautiful scan in there, all right? That allows us to make sure we have very highly accurate scans. We take 6,000 images a second. So think of that, 6,000 images. All right, so we want to make sure that this image here is as clear and crisp as we can. Later, we have the ability to actually go through, when I mean we, the company, have the ability to go through those 6,000 images. So if all of a sudden this becomes not the best scan, we can go back with our team in Costa Rica and actually go through those photos to save that crown or save that margin to make sure it's fine. We call it finding a remake before it's in your chair. We find it an hour or two after the scan happens, which is really great. And usually we can save your butt because we're able to find where the margin was prior to any saliva or blood interfering. All right? So we go there, we take this green dot, we just want to make sure it's in the center, so we move it there. That just has to do with the path of insertion and also notating that this is the prep arch or the prep section. All right, we're then going to hit the arrow. We're going to go over. Now we're going to do the arch. I'm just going to go ahead, scan right on the tooth surface, occlusal lingual buccal. So turn it on. We're just going to build our scan up and go about a 45-degree angle. Build up your image. Rotate over to the buccal here. We're just going to go through. Now here, what we want to make sure is we want to make sure that we get our contact points, okay? So I'm just going to turn it off real quick. Take a glance, and we are missing some of our contacts, all right? So we're missing our distal and our mesial contacts. So we want to go in and clear those. We don't have to worry about our interproximals on the other teeth because that's not going to affect the fit of the crown, but this is surely going to affect the fit of that crown. We want to make sure we have a nice contact. So we're going to hold down the screen. We're going to hit this fill tool. What fill does is it allows you to select just that area to capture data. So what scanners do is they keep collecting data, and building layers. Think about it. You have some saliva, you have some blood, and now you scan over it and you're adding that layer. We want to minimize that and really mitigate the risk of having literally contaminated scan. So that's what we try to do is do that. So now I'm going to turn on the scanner and I'm only going to be filling in those areas. So now here I'm just going to try to get my mesial contact as much as I can. I'm going to go rock this way, get my distal contact and just take a quick look again and go from there. All right, turn tooth colored, we're good to go. Then we would go to the next. We're going to go ahead and do our opposing arch. I'm just going to flip this around here. This poor patient, just kind of manhandling them around. All right, so start on the occlusal. Again, same thing. Occlusal, lingual buccal. All right, now here, really what we want to get is we want to make sure we have a nice clean occlusal surface. And also, make sure we have enough on the buccal and the lingual. All right, so we're just going to take a quick look at what we got. Looks pretty good right there. We don't need to worry about those interproximals because that's not going to affect the fit of the crown. All right, what we see a lot of common issues are with our scanner is people trying to overscan, spending too much time because they collect data that they don't necessarily need. We're then going to proceed to our bite. All right, we're going to have the patient go ahead and go into full occlusion. We're going to stick the wand in right on the side. We're going to turn it on and we're just going to simply just move it up and down. All right, and what's going to happen on the scanners, you're going to see it just locks into the tooth. Turns purple, it means we're good to go. And now what we're going to do is we're going to hit our button up here, which is called post-processing, and that allows us to process and bring every scan together. We have a nice little clock setting on here that tells us how long it took us to scan, 4 minutes, 38 seconds. But what I really love about the scanner is we use a tool here that's very similar to our occlusalgram, right? It looks like it, but it's not. It's called occlusal clearance. And it's exactly what it says. It's the clearance that we have for our occlusal. So we know here, looking at our guide, we can change the scale to any scale that we want. And we can see if we have enough room or enough reduction for the material of choice, all right? So if we do have to go in here and reduce a little bit more, we have that ability. So what we can do is we could single out the prep, right? We could then hit this eraser button. And what we're going to do is we're going to draw a little halo right over this occlusal surface here. And what it's going to do is it's going to allow us, we hit the scan button, to just scan in that new height. So as you can see here, very quickly, I've done this a couple times, you can tell I've kind of gotten it down. I did not touch my margin line at all. Again, all about maintaining that margin, keeping it clean and keeping it clear of any contaminants. So now we could go ahead, touch it up with a burr, and now we could capture that new height. We simply just turn the scanner on. We're just going to capture that new height. And within a couple of seconds here, we're able to literally reimpress that patient with the new height. All right, we're then going to go ahead, add it to post-processing. It's saying me that I should take another bite scan because, again, you should take another bite scan, but we didn't touch it with a burr, so it's not going to it's not going to allow me to do it for the type it on. All right, and then from there, we'd be able to hit the send button and send it right off to the laboratory. All right?
Hey guys, so that was just a day in the life at East Amherst Dental Center. We have lots of friends like Joe popping in with really cool technologies. This is amazing. iTero is awesome. I think you saw it for yourself. So if you want to learn more, check out the links below. And if this was helpful for you, like us, follow us, subscribe, you know the deal, and come visit us at igniteDDS.com.